Hello, everyone. This is Nurse B with Buzzing with the Bee. Today's episode is entitled, Should You Take the COVID-19 Vaccine? And this is a question that everyone has to decide for themselves. I'm going to give you some information about the vaccine and the latest information that I can find. And hopefully this will help you to make a decision of what you want to do. It certainly helped me. But before we go further, I want to direct your attention to the like, share, and subscribe icon that's floating on my picture. If at any time you like this video and want to follow me, please press the button so that you can follow me in future vlogs. Thank you. Hey, let us talk about the side effects of the COVID-19 vaccine. I'm sure that you are aware of the minor side effects, which include fatigue, low-grade fever, muscle aches and joint pain, as well as redness at the injection site. The more serious side effects or adverse effects include anaphylactic reaction. And in anaphylactic reaction, the people who most likely experience that had severe allergies to many different products, and they usually have an EpiPen that they use in case of that. The CDC did not take them off the list of people who could get the vaccine. So if you decide that you are going to take that vaccine and you have a history of allergies, you need to take that at an emergency facility so that they can monitor you for 30 minutes and have equipment available in case of an anaphylactic reaction. The other thing that I have been seeing on the internet is that people are reporting Bell's palsy. Well, one of the side effects of it, the vaccine, is temporary numbness, tingling, and drooping of your face. Usually that's a problem that affects your facial nerve, and in about 2 or 3 days it's gone. If you think that you're having that problem, you really need to see your doctor so that the doctor can do some further testing to see if you have that problem. Now, Bell's palsy is not limited to just the COVID-19 vaccine. It does occur in other vaccines too. Now remember that the COVID-19 vaccine requires 2 doses. So on the second dose, this is when people will have a more intense flu-like symptom because your immune system is already revving up to fight the infection. So then once they get this virus into your body again, then it's going to really kick into gear. So again, you will have the fatigue, low-grade fever, muscle pain, and joint aches. You can expect this to happen. Now, my next question is, when you say you have a fever, how are you measuring that? The days of putting your hand on somebody's forehead and saying they have fever is over, okay? You need a thermometer. So if you do not have one, go and get one. You can get just a simple electronic thermometer. It costs around $5 and it prints out the number. You don't have to try to read it. So please, if you do not have a thermometer, get one. So if you go to your doctor and you said you have a fever, then you can give the doctor a number. Well, let's say that you already had the disease. Do you need to take the vaccine? Well, the CDC is recommending that you take the vaccine even though you have had the disease. We know that one way to get immunity is to have an active infection and get it naturally. However, they're saying that they don't know how long the antibodies will last, if they last just a couple of months or whatever time period. So they are recommending that you take a immunization, but they want you to wait at least 90 days after you've had the symptoms or the disease and talk to your doctor first. Now, me, I want a titer. I want to see if I have the antibodies. If I have antibodies, I personally don't see why I should get immunized because they don't know how long that lasts either. So that's going to be your decision of where you go with that. Because this is a new drug, the Federal Drug Administration will continue to monitor the side effects of this drug. The healthcare people has the vaccine adverse event reporting system that they will provide information of any type of reactions that occur with the vaccine. Also, when you take the vaccine, you should have been given information about the VSafe smartphone program. This is a tool that gives you messages to fill out a survey at different points to monitor the effect of the vaccine. I would do this because I want to make sure that if I have a side effect, that other people know about that side effect too, especially if there's something different. I want to do my part with helping the world. The latest breaking news about the coronavirus is that a new variant of the coronavirus has occurred in England. It started in London. Several European nations have banned travel between their country and Europe and England. The United States has not done that yet. The question is, will it spread to the United States? Yes, we already know that it's coming here, if it's not already here, because people travel back and forth by airplane all the time. So most likely it's already in the United States, and Dr. Fauci agrees with that. I stated that earlier. Question is, will the vaccine work against this variant? We don't know for sure. We hope so. Now, in my last video, I told you that I was leaning toward taking the vaccine, but I wasn't sure if I wanted to take it right away. Well, this variant of the COVID vaccine will make me run to take the vaccine. I need some type of immunity. It may not completely give me full immunity to this new variant, but it may help to prevent me from getting a serious case of it. So this is the thing that makes me want to get it. So it's a decision everyone has to make. Now, there are some conspiracy theories surrounding the vaccine. I read about a couple of them. One of them was the disappearing needle. Well, that's a safety needle that we use. You push a little button and the needle retracts back into the syringe, and therefore the nurse won't stick herself. The other was that a nurse died from the vaccine. As far as I know, that has not occurred. Some healthcare workers, about 4, have had anaphylactic reaction. The other was Bell's palsy, which we have addressed earlier. And I don't know how people can believe this, but it is that the COVID-19 pandemic is not real and that there's no disease. I think for some people, they won't believe it until they actually get it or a family member gets it. So why are people so leery about taking the vaccine? Well, there is a lot of misinformation and disinformation out there about the vaccine and about the virus itself. Misinformation is false or misleading information that is inadvertently spread, whereas disinformation is false and misleading information that is deliberately spread. You have another thing called malinformation, and this is information that's based on truth, but is altered in a way to deliberately cause harm. So what contributed to this misinformation and disinformation? Well, 2 things: lack of transparency and mistrust. In the lack of transparency, the Trump administration had not been truthful to the American public and withheld information. Also, the Trump administration set themselves up as antagonists against the scientific community. So people really didn't know who to trust, who to believe. So this led to more mistrust of the medical community. The medical community, especially with people of color, has had problems with mistrust because of history of research with people of color that did not disclose pertinent information, and the people were not valued in the research. The data, the outcomes of the study had more value. So therefore, people just don't trust him. And we have to work on getting trust. We have a group of organizations like the blackdoctors.org that will monitor and are monitoring drugs, the use of people of color in research projects to make sure that we are not taken advantage of again. Also, there is legislation out there to prevent, called the Belmont Report, that was used to establish rules for research. And some of those rules is that you have to have full consent, that you can withdraw at any time, and that if a medical treatment comes available, that everyone in the research will eventually receive it. And that the human life takes more importance than the research itself. In the government mistrust, a lot of that stemmed from the fact that the vaccine was produced rapidly. It usually takes a couple of years for a medicine to be, new medicine to be developed. But with this pandemic, a lot of money has been put forth and a lot of focus on drugs for this has occurred. And so we've been able to make a vaccine much, much faster. Also, some people say that they will not take anything produced under the Trump administration. Again, the Trump administration appeared to put pressure on the FDA to approve it, the vaccine. So people are just leery of that and their interference. So they just don't know what to do. Okay? And then social media is a whole nother monster by itself. People put all kind of information and misleading information about the virus and the vaccine out there. One of those things is that the vaccine contained a microchip. That's not true. It does not contain a microchip. You can find the information that's listed about the ingredients in the vaccine. Also, there is no COVID-19 pandemic or disease. It's all lies. So these are some of the things that's out there that causes people to be leery about taking the vaccine. Several frontline workers are leery about taking the vaccine. They have the same fears as you do, the public. The mistrust of the government. They feel that the White House has pressured the FDA to approve it. The safety and efficacy of the vaccine. We know now that it's 90% efficacy rate and very few side effects that we know of at this point. The other concern that frontline workers have is that their employer can recommend or require them to take the vaccine. Yes, they can. They can make a requirement that you take the vaccine. However, if you have a disability, there are some exemptions from taking the vaccine. So you'll need to talk to your doctor. To make that decision, it's based on whether to take that vaccine. It's really based on trust. So who do we trust? We trust Dr. Anthony Fauci. Dr. Fauci has stood up under a lot of adversity from the Trump administration for the public about the coronavirus and how to protect ourselves. And he does recommend, and he has taken the vaccine. I think that that goes a long way in relieving some of the leeriness that people have about taking the vaccine. I hope that you have found this video to be helpful and it has allayed some of your fears about the COVID-19 vaccine. I want to thank you for viewing this. I know it has been long, but it's very hard to get information out, especially information like this in such a short period of time. So if you want to follow me, please press the subscribe button that's floating over me. And you can follow me by logging on to my webpage, nurse-b.com. Again, thank you for joining with me, Nurse B, on Buzzing with the Bee.